Namaste, Vanakkam, Swagatam, Bonjour, Buongiorno, Buonasera, Buonanotte, Puya More, Boreda, Kyo, Ora, Salamat Pagi, Ayu Bhovan, Ayushman Bhava, Shubh Dinam Suprabhat. Best wishes to my global yoga family, and especially today my Yoga Chikitsa family, the Yoga Therapy family worldwide. Today, the 14th of August, we are celebrating the Global Yoga Therapy Day. I congratulate the International Association of Yoga Therapists for making sure that we all have a great time today. We have an amazing program lined up by the IAYT, and on behalf of Ananda Ashram Pondicherry, the Dr.Ananda Yoga Parivar, and of course as chairman of the Yoga Therapy Subcommittee of Indian Yoga Association, I offer my congratulations and best wishes to each and every one of you. The Global Yoga Therapy Day was started many years ago, and I remember Anne Mary, who had the Yoga for Better Health and Yoga Meet in Australia, connecting to me for the very first time they had it, and at Pondicherry in our Sri Balaji Vidyapeeth, we commemorated it with a special event in the MRD area where all the patients come to register in the hospital. After that, I have been part of many of the online events, including a very amazing yoga therapy conference that was held a few years later. This year, I'll be participating later, 12 hours from now, in the Global Yoga Therapy event by IAYT, and sharing about enhancing our perspective, because yoga is not just something you do, yoga is something you are. And these teachings, these concepts, the practices, the philosophy, the psychology, the spirituality comes alive in us, and that is where it becomes Yoga Chikitsa, the application of yoga as a therapy. We need to remember at this point that yoga therapy is neither separate nor greater than yoga. And this is why it is vital as a yoga chikitsaka, as a yoga therapist. It is very vital that we keep the yoga in yoga therapy. Because if we don't keep the yoga in yoga therapy, it is no longer yoga therapy. And when I say keep the yoga in yoga therapy, the connection to its fertile soil, the Indian culture, the culture of Sanatana Dharma, the culture of Akhanda Bharat, that encompasses much of what today we know as Southeast Asia. When we talk about yoga as a therapy, yoga chikitsa, it is multidimensional because it looks at the physical, it looks at the psychological, it looks at the emotional, it looks at the social, and it looks at the spiritual dimensions of who we are. Multidimensional. So it is not just a physical workout. It is not just body work and breath work and mind work. And as my dear Hindu likes to say, yoga is not a work out, it is a work in. We need to go in, because in is the way to go. And in the process of yoga therapy, we as yoga therapists must enable two things to manifest in those who are seeking care from us. Those who are the care seekers, in some countries they call them participants, in other countries they call them patients, in other countries they call them clients, but they are all seeking care from us. They are care seekers, and we are to be care providers and caregivers. So caregiver means give care, not just the practices, but care for the individual as a wholesome being. We need to remember that the principle here to be adopted is the 2T principle, and to avoid the 1T. You say, what is 2T and what is 1T? The 2 T's that you want to manifest are transformation and transcendence. So through the process of yoga, whether it is being applied as a sadhana for the individual's own spiritual growth, or whether it is being applied as a therapy to relieve suffering, the most important part that we must never forget is there has to be transformation of the individual. A transformative journey. A journey from illness to wellness. From pathogenesis to salitogenesis. We all know the Vedic mantra, Asatoma Sadghamaya, Tamasoma Jyotirghamaya, Mrityorma Amritangamaya, Hari Om Tat Sat. Similarly, there has to be a transformation from the material to the spiritual, from the mundane to the higher. And this transformation from illness to wellness, from a state of suffering to a state of ease, from dis-ease where you have lost the ease to a state of ease, sukha, from dukkha to sukha, from a very dejected, depressed mental space, dhava manasya, to a very elevated, cheerful mind space, saumanasya. That transformation is vital in yoga chikitsa or yoga as a therapy. And the second is transcendence. So one T is transformation, the other T is transcendence. We have to enable the individual to transcend. So you transform and you transcend. There's a lot of overlap in the Venn diagram of transformation and transcendence. And it is about enabling that individual to be the best version of themselves given their genetic predispositions and the environmental conditions in which they exist. It is difficult to change the genetics and quite difficult to change the environment these days, which is very pathogenic. But can we enable the individual to change the perspective towards life? Can you give a new dimension towards suffering? Can you give a new dimension towards the stressors that are omnipresent in every person's life? That is where transformation and transcendence are both vital in the journey of yoga, chikitsa, yoga as a therapy. But then you say, Dr. Ananda, you said there is one T that you want to avoid. Well, that is the transactional nature of modern yoga. The transformation and transcendence of yoga is being replaced by transactional behavior in yoga, where it's become all about transaction. Transaction is very material. Transaction is very limiting. And when we love someone, we don't want it to be transactional. We would love that love is transformative and transcendental, not transactional. You give me this, I give you that, and if you give me this, I will give you that. We have to be very mindful that we don't get into this transactional aspect that has pervaded modern yoga. In the traditional living teachings of yoga, It is transformative and transcendental, not transactional. And as long as it is transactional, the relationship will never really be healthy. And the core of Yoga Chikitsa is a therapeutic relationship between the therapist and the care seeker who has come to you. And if that therapeutic relationship is to be truly yogic, the transactional aspects need to be minimized. We have to minimize the transactional aspects, enhance the transformative and transcendental aspects. Then it will really be Yoga Chikitsa. The Indian Yoga Association, of which I am currently Joint Secretary, has embarked on a very beautiful path of recognizing those who are practicing yoga as a therapy. Those who have recently graduated from such programs, who are starting off on the journey of being a yoga therapist, can have recognition as a Yoga Chikitsa Sahayaka, as someone who can assist the yoga therapy process. Those who have had a decent amount of exposure, at least 3 years of documented practice, well, they can become a Yoga Chikitsaka, someone who can embody yoga as a therapy and help care seekers move from suffering to ease. And those who have more than 10 years of documented experience teaching others, guiding others, mentoring others in the field of Yoga Chikitsa, well, Yoga Chikitsa Acharya recognition is there. So Yoga Chikitsa Sahayaka, Yoga Chikitsaka and Yoga Chikitsa Acharya. And for the pioneers who have led the way, we are honoring them with the recognition of Yoga Chikitsa Ratna. I really think this is a very important development in the field of yoga, and our Indian Yoga Association that brings together so many of the living traditions of yoga. More than 40 member institutions who are embodying the living traditions of yoga and are linked to the various parampara. More than 250 associate centers who are, doing amazing work in the field of yoga are part of the Indian Yoga Association. I welcome everyone to join us. And once again on this Global Yoga Therapy Day, August 14th, I congratulate the International Association of Yoga Therapists for keeping up the tradition of celebrating this day, commemorating this day, and looking forward to seeing all of you in 12 hours from now, where I'll give a practice session on enhancing perspective through yoga therapy. But before that, in just a few hours from now, another 2 hours, we have an open forum on yoga therapy, Yoga Chikitsa, being organized by the School of Yoga Therapy at our Institute of Salitogenesis and Complementary Medicine. Look at the announcements I've been making, and you can join us on Zoom for it live. If not, it's going to be broadcast on all our different channels and you can watch it, where many of our yoga therapists and the mentors are going to come together to share the experiences in the usage of yoga as a therapy. Let us all grow and glow through yoga. Let us become the best version of ourselves, and let us enable others to become the best version of themselves too. Hari Om Tat Sat. Namaste, Dhanyavad. Thank you so much for being with me. Love you all so much.